Today is October 5th, 2025. This video is on two sui generis articles, one published in Science Advances on 24th September 25, titled Synchronization of Women's Menstruation with the Moon has decreased but remains detectable when gravitational pull is strong. And the second in BMJ Mental Health, titled The Menstrual Cycle and Overlooked Vital Sign in Psychiatry, as a question. Menstrual cycles and moonlight. Human menstrual cycles resemble the lunar cycle, leading to theories of circle-lunar synchronization. Many species, especially aquatic, synchronize reproductive activity to lunar phases, possibly enhancing fertility. This study evaluated 176 women in Germany, Italy, Israel, and North America. Average age at record start was 26 years. Cycle length 27.9 to 30 days. Data was collected over 2 to 37 years, mean 6 years, using calendars, apps, Excel. Analysis included 11,565 menstruations. Methods utilized: raster mensograms, circular plots, Rayleigh tests used to analyze entrainment with the three lunar cycles: synodic, anomalistic, and tropical lunar cycles. What did they find? Significant bimodal alignment with new moon or full moon was found between 1950 and 2010 data. It was lost after 2010 data due to artificial light. Around 2010, there was more LED lighting and cell phones, so more artificial light. They found there was persistent influence coupling to lunar gravity in the anomalistic and tropical months and remained during solstices. Regional differences: stronger synchrony in Germany versus Italy, potentially linked to light pollution levels. Limitations of the study: observational study, self-recorded data, causality not confirmed, actual light exposure not measured. Key takeaways: menstrual cycles behave as circulunar clocks. Entrainment persists under strong gravimetric cues despite modern lifestyle disruption. The raster mensogram used: visualize the alignment of the menstrual cycle, onsets with lunar cycle. Each row equal to one menstrual cycle, each column a day in the 29.5 day lunar month. A mark was placed on the day menstruation starts to form the raster of cycles over time. If the cycles align with the lunar phases, example new or full moon, vertical clustering appears. It was used along with the Rayleigh test to detect non-random synchrony across cycles. John William Strutt was the third Baron of Rayleigh, a British physicist, peer and a Nobel laureate. Discovered the noble gas argon in 1894 with William Ramsay. Awarded Nobel Prize in Physics in 1904. He explained Rayleigh's scattering, the reason the sky appears blue. He authored the seminal book The Theory of Sound, establishing the principles of acoustics. The Rayleigh test is used in circular statistics to detect non-uniformity. It was applied in this Science Advances paper. Next, we will discuss the BMJ article. Why do these authors say that the menstrual cycle considered a vital sign in psychiatry? It can influence health symptoms, suicide risk, and hospital admissions, offering a modifiable diagnostic and therapeutic factor. What is premenstrual dysphoric disorder? It's a mood disorder marked by affective, cognitive, and somatic symptoms confined to the premenstrual phase, newly classified under ICD-11. How is premenstrual dysphoric disorder diagnosed? By prospective daily symptom tracking across 2 menstrual cycles, adhering to strict criteria. What treatments are available for premenstrual dysphoric disorder? SSRIs, often effective in 48 hours, and ovulation suppressing hormonal therapies like combined oral contraceptives. How does premenstrual dysphoric disorder differ from other psychiatric disorders? SSRIs can be used intermittently and act faster. Hormonal sensitivity is a root issue rather than hormonal imbalance. What is premenstrual exacerbation? Worsening of symptoms in existing psychiatric conditions like psychosis or depression during menstruation without full remission post-menstruation. Which psychiatric and medical disorders are linked to the menstrual cycle? Psychosis, bipolar disorder, depression, panic disorder, eating disorder, migraines, epilepsy, and asthma. What are suicide and hospitalization risks associated with menstruation? Meta-analyses show increased psychiatric admissions and suicide attempts during the premenstrual phase. Can menstrual symptoms predict future psychiatric risk? Yes. The PMS predicts postpartum and perimenopausal mood symptoms. How can clinicians stratify care based on menstrual cycles? By identifying hormonal triggers and tailoring interventions during vulnerable reproductive transitions. What is the patient experience of menstruation-related psychosis? Patients report early warning signs, example insomnia, perceptual changes, preceding episodes of psychosis. What hormonal treatments are effective in schizophrenia? Adjunctive estradiol and hormone therapy reduce psychiatric symptoms and hospitalizations. Why is menstrual dignity important in psychiatric settings? Women face barriers like lack of period products and trauma triggers in inpatient care. What practice interventions can be taken for inpatients? Ensuring period product access, pain relief, and respect for bodily autonomy. Are psychiatrists trained to consider menstrual factors? No. Current curricula and licensing exams lack sufficient mental health content. What are the key barriers to menstrual awareness in psychiatry? Cultural silence, male-centric research history, and clinician discomfort. Why is menstrual inquiry crucial for patient dignity? It validates symptoms, removes stigma, and improves patient-clinician dialogue. Can discussing menstruation be intrusive? Patients liken it to being asked about suicidal thoughts, necessary and appropriate. How can asking about cycle improve care? It supports diagnosis, predicts relapse, guides therapy, and empowers patients. What systematic changes are recommended? Integrate menstrual inquiry into training, routine assessment, and research.